I'm Bob Alpern. I'm the Dean of the Yale School of Medicine, and I'd like to welcome you to one of the happiest days at Yale, the white coat ceremony. The other happy day is graduation. We'll all be back here. So family members, alumni, faculty, staff, and most importantly, our newest students, the class of 2023, welcome to the white coat ceremony. Parents and relatives, I imagine you have to be incredibly proud, and so you should be. Today represents the culmination of decades of commitment on your part and the part of our newest students. Students, today is a momentous day in your evolution to become a physician. Dr. Emily Wang will speak to you shortly on an important theme, if there is just one thing. Before her talk, I'd like to take just a few moments to comment on the Yale School of Medicine, what it means to you and what it means to us, and what you mean to us. Together, you represent just over 2% of those who applied for a seat in the class of 2023. 104 individuals with extraordinary academic and extra-academic accomplishments. 51 men, 53 women, 85 MD students, and 19 MD PhD students. 10 of you have already earned an advanced degree. You graduated from 54 undergraduate colleges, and 32 of you were born outside the United States, representing countries of Bangladesh, Canada, China, Colombia, Indonesia, India, Jordan, Korea, Nigeria, Nepal, Portugal, Singapore, Turkey, Vietnam, and Zimbabwe. The emotions of today. The emotions of today are best captured by the comments that were made by the Dean of Yale College my first year here when my daughter was admitted to Yale College, and I always remembered this because I thought it was brilliant. And what he said was, "I can sense today feelings of pride, perhaps tinged with anxiety, of excitement moderated by vulnerability, and of the thrill of new places tempered by nostalgia for what one has left behind." And these are just the feelings of your parents. Yale School of Medicine is a unique medical school. It combines outstanding faculty with remarkable students and a tradition of excellence that dates back over 200 years. In 2010, we celebrated the school's bicentennial. In 2012, Brian Kobilka, a Yale School of Medicine alum, was awarded the Nobel Prize in Chemistry. In 2013, Jim Rothman, chair of the Department of Cell Biology, was awarded the Nobel Prize in Physiology or Medicine. In 2015, Vivek Murthy, an alumnus of our school, was sworn in as the Surgeon General of the United States. In 2016, 5 of our young investigators were named Howard Hughes Medical Institute faculty scholars to recognize the best biomedical researchers in the country. Yale tied with only one other school for the highest number of awardees. And there are many other stories. Yale University awarded the first medical degree in the United States in 1723. Now, we were not the first medical school because in those days, regulations were not as strictly enforced as they are today. And Yale was able to award a medical degree 87 years before it had a medical school. The other interesting thing is that the awardee was never in New Haven. I won't say how he got the degree. Since Yale School of Medicine was officially established in 1810, the names of those who have walked these halls are astonishing. And now you will walk these halls. Many of you are probably wondering, how did I get into Yale? Do I belong in the same place that has educated so many of the greatest minds in medicine, those who define the discipline of medicine as we know it today? The answer, believe it or not, is a resounding yes. I want to assure you that your admission to Yale was not a careless error, but an acknowledgement of all that you have accomplished and all that we know you will accomplish in the future. The Yale system is unique among medical schools. You will not receive grades during the preclinical years, nor will you be ranked. Why is that? Were we trying to make it easier for you? No. The answer is we expect greater things from you than grades could ever engender. We expect you to become a leader in the medical world of tomorrow. You're probably thinking, not me, but you will be surprised. Your intelligence, your commitment to excellence, and your Yale education will place you among the leaders in medicine, no matter how you choose to pursue this. It is our hope that you will seize this opportunity to develop into an outstanding physician, a critical thinker who learns what he or she needs to know, but is not content with that. You will establish new understandings of disease processes, new approaches to patient care, and new paradigms for the practice of medicine. Some of you will do this as practicing physicians, some as academicians focused on research, clinical medicine, or education, some through health policy, and others through involvement in industry. We have enormous confidence in you. You're surrounded by outstanding classmates, but you should not see them as competition, rather as part of a team that working together will ensure that the world is a better place because Yale School of Medicine had a class of 2023. If we do our jobs and you do yours, years from now, students will walk the halls of the medical school wondering if they belong in the same institution that trained the class of 2023. Thank you. So one of the traditions at the white coat ceremony is that we have a faculty member present the white coat talk. And today's speaker is Emily Wang. Emily got her undergraduate degree at Harvard University, and we forgive her for that. She got her MD degree at Duke, and then a master's at the University of California in San Francisco. She did her internship, residency, and a general medicine fellowship at UCSF. And then in 2008, she joined the faculty of Yale, and today she's an associate professor on our faculty. In 2016, she became one of 6 faculty academic advisors to the students. She also has co-founded a transition clinics network which provides health care to ex-prisoners, and I'm sure she'll be talking about that. She has many accomplishments in her career, but I thought I would summarize just a few of them. In 2002, she won the Caring for the Community Award from the Association of American Medical Colleges. In 2012, she was a nominee for the Leonard Toe Humanism in Medicine Award at Yale University. In 2012, she was a member of the Institute of Medicine workshop on health and incarceration. In 2016, she was a member of the steering committee of the Institute of Medicine workshop on improving collection of indicators of criminal justice system involvement in population health data programs. And in 2019, she was a member of the technical expert group of the World Health Organization on Health in Prisons program. Emily will speak to us today, If There Is Just One Thing.
A deep thank you to the deans for inviting me to speak today. Well, it is a real honor to be here this afternoon. A big welcome to the class of 2023, to your family and friends. This important rite of passage is an opportunity for us all to reflect with you as you start your journey in medicine on the meaning of our profession, which at its core is centered around improving the health of our patients and our responsibilities to them, to our community, and to each other. It's been almost 20 years since I participated in my white coat ceremony, and I'll be honest, I don't remember as much as I should about my formal medical education. But my white coat ceremony stands clear in my mind still today. I'm one of those people that since I was young, I knew I wanted to be a physician. My father passed away from colon cancer when my sister and I were young, and his illness and his interactions with his physicians set me singularly on the path to medicine from a young age, a clinical career, one focused on curing disease, one patient at a time. So I remember feeling a serious amount of excitement, almost to the point of nausea, finally to get my stethoscope and my white coat, to be entering the profession. I finally made it. On a day just like today, I listened to the white coat speaker reflect on the values of our profession, and the remarks ended with one primary point that was valuable that I wanted to share with you today. If there's one thing you should know, he said, it's that it's critical to walk in our patients' shoes. The speaker implored us to hold compassion and empathy as the hallmark in clinical care, as important as scientific excellence. This resonated with me. I'd spent 2 years working in a hospice in Boston and spent many hours with women in their final months and could see that it was both medications and a physician's connection to her patients that mattered. It felt clear to me then that to be the doctor I wanted to be, I had to develop expertise in pathophysiology, pharmacology, also get good at interviewing and building trust with my patients. But in looking back, my thinking was limited. The skills that I thought I needed were too narrow, and what's being asked of you as a new generation of physicians requires these skills and much more. The news is filled with stories of injustices in the healthcare system, restrictions on women's rights and abortion, exorbitant costs of medications. So what does it mean to walk in our patients' shoes today? I want to reflect on my own path through medicine and share with you a handful of tips I wish I'd known at the beginning of my career. First, foremost, get out of your comfort zone. For me, preparing for medical school meant I'd spent time in a lab and in a hospital. So getting out that comfort zone meant getting off of campus, outside of the classroom, because it was there that I started to see the many forces that impacted my patients' health and even changed my path in medicine. I came to medical school squarely fixated on being an HIV physician. This was during the HIV epidemic, where hospital wards were filled with patients dying of AIDS. To become an HIV physician, I focused on basic science research and worked in a top-notch lab at Duke, studying the immunology of acute HIV. But it was outside the lab, while having a conversation with a friend of mine who worked in the prisons, that I learned that the US has the largest prison system in the world. 1 in 100 US adults are behind bars. There are large racial disparities of who's behind bars. Whites and blacks commit crimes at equal rates, but blacks serve longer sentences and are disproportionately represented on death row. People who are incarcerated have higher rates of infectious diseases than the general population, including HIV. As a budding HIV doctor, this blew my mind. So I made a point to visit the women's prison in Raleigh, North Carolina, to learn more and discover that, in fact, the rates of HIV and sexually transmitted diseases were 4 times higher in these young women than the general population. I was asked to lead a health education program focused on women's health. And it was through these classes that I was giving, I started to see how the skills we're learning in medical school, even the tools we have to prevent unwanted health outcomes, wear a condom, get tested for HIV, lied squarely on the individual and rarely addressed the bigger issues at hand. Every single one of the women I met had been physically and repeatedly assaulted in their lives. Their insurance didn't cover certain forms of birth control. They lost their jobs because they didn't have paid parental leave. The doctoring tools I had felt weak. Imploring these women to change their behaviors in the face of these realities seemed to miss the bigger picture. Stepping into a prison, of course, getting out of my comfort zone, set my career on a totally different trajectory. From this day forward, you too will have opportunities to get out of your comfort zone. This might mean you pushing yourself to learn a new language, doing home visits, writing an op-ed, writing a poem, traveling to rural Appalachia, or to the Indian Health Services to get a glimpse at the realities of a part of the U.S. that you just don't know. You now have this new perspective and power as medical students, which I'm confident is going to shift your understanding of health. My second piece of advice is to read at least one book on medical history. One of my favorite books is And the Band Played On, a book written in 1987, which is an exhaustive history of the AIDS epidemic, chronicling the neglect of governments and the medical establishment in the early years of the epidemic. The author's premise is that AIDS was allowed to happen. While the disease, as we know, is caused by a virus, incompetence, apathy, homophobia, racism allowed its spread to become much worse, and this included doctors and scientists, some of who are very much alive today. Reading this history, I felt that it's the story of us all. We're part of history in the making, and we're flawed and biased ourselves. In my career, I've been schooled over and over again, often by patients, that our power as a profession has both been a force for tremendous agency and progress, but also as a force for oppression and cruelty. Perhaps nothing illustrates this better for me than physicians who work in prison. During residency, I worked in San Quentin prison. Healthcare is interestingly constitutionally guaranteed behind bars. It's one of the only places in the US where there is a constitutional guarantee for primary care. 13 million individuals pass through our correctional system each and every year, and many first access primary care when they're incarcerated. So by necessity and by law, doctors work behind bars. Some of the most amazing physicians work there, ones who've started the first opioid treatment programs in jail, who've quit their jobs refusing to participate in the death penalty, organized against solitary confinement and the shackling of women when they're delivering babies. But I've also seen how the very practice of medicine in a correctional setting is an exercise of structural violence, how our history impacts our patients. Let me give you an example. For the past year, my team has taken care of a patient in Yale's primary care who had spent decades in prison and was HIV positive, not on any medications, but with stable low-grade disease. He was and has been insistent on not taking any medications, in spite of newer recommendations that show benefit for all HIV patients to be on antiretroviral therapy. I never really quite understood why until recently. He's in the ICU now with a severe infection, a gangrene in his leg, and an HIV virus which is now uncontrolled. Still unwilling to start medications, we went to his bedside to talk, and with tears in his eyes, he recounted his experience over the past 30 years, the stigma of being diagnosed in the 1990s in prison, when the disease was defined by physicians and scientists as a gay cancer and didn't include patients like himself, a heterosexual Black man. Being mentored by an older man who was also HIV positive, who ended up dying in prison immediately after starting the first generation of HIV medications that were quite toxic, and being completely isolated from the new advances in medical knowledge on HIV while in prison. My patient's story is the history of HIV. The stigma fueled by medical professionals and scientists, the fear of the unknown, the human errors of medical knowledge in its infancy and the mistrust of physicians and medications, and it's in knowing that history that our team could finally acknowledge the past wrongs of our profession, validate his fears, and re-engage him in treatment. These white coats that you'll be wearing, they have a history, one that you should know. And remember that each and every time you enter a patient's room, you carry that history with you. My third piece of advice is that the practice of medicine is inherently and increasingly political. Your generation of physicians is the most challenged, I would contend, by moral choice. The cost of drugs, including insulin and epinephrine, have skyrocketed so high that patients are dying for lack of access. Hospitals today are worried about cost containment and concentration of the market share. When I was where you were, I thought that healthcare organizations were at the core ethical. They put their patients first. This is a naive view. It's much more complicated than that. But your role as physicians does not have to be. Who you choose to care for, whether your health system accepts certain insurance, what you speak out about or don't, are all political decisions. And let's be clear, you don't have to be a political activist to advocate. There are advocates all around you. Take Dr. Kaja Lipska, who as an endocrinologist, a physician scientist here at Yale, is leading a national discussion on the inequities of insulin pricing. Or Dr. Dirk Johnson, a trauma surgeon who is actively working on mitigating gun violence in New Haven. In my own career, I have found that keeping myself honest to the urgent and political nature of our work is done by partnering with patients. It's easier to be a bystander, to keep silent when you don't have to pay for insulin, aren't living in communities that are under the threat of gun violence, or have not been incarcerated. Remember that your silence is also a political statement. My lab has worked to build the largest primary care network of primary care programs in the U.S. that care for individuals with a history of incarceration when they're released. This has meant pushing up against health system policies that discriminate against people with criminal records and being vocal about how the health system is broken for the millions of people who have been incarcerated, both behind the walls and outside. Throughout my career, I've been told that this work is just too political. But how can we practice medicine, keep our professional responsibility to our patients at the fore without engaging in politics, without speaking out, especially when our patients' health are compromised by systems that discriminate, commodify, and literally shackle our patients into poor health? So remember this. Starting today, your white coat gives you the privilege to bear witness to your patients' suffering and their strengths, to share that burden, and then to safeguard their human and civil rights. Here at Yale, you'll certainly obtain the knowledge and skills to provide patients counseling, prescribe a med, enter an order, close a wound, even deliver a baby. But use this time to get out of your comfort zone. Use this time to learn the history of medicine, the policies that have promoted or harmed patient health, and how we as a profession can advocate for our patients. Use it to listen to and learn from your patients in the New Haven community, who can teach you the history, the underbelly of medicine, and the solutions that are right under our noses. Use this time to become excellent scientists, know the literature of health disparities and equity. We cannot be indiscriminate advocates. Use the science or build it to become better ones, because this is what your patients need you to do. Of course, there are going to be many times when obtaining or exercising these skills are going to feel challenging, will make you and others feel uncomfortable and exhausted, will push you against professional and institutional norms. When you feel enraged, wary, isolated, or burdened, I want you to remember this. Look around. No, really, look around. Look around at this beautiful community of future doctors. Let that embolden you when you're feeling powerless, and organize us in partnership with our patients. Just this past week, there was an op-ed written in the New Yorker by Dr. Eric Topol examining the recent history of our profession, the moral challenges of us practicing, imploring us physicians to organize against the injustices in the healthcare system. He suggests that our apolitical stance as physicians undergirds our current predicament, but that there is hope that a new class of physicians is rising up. Forget hope. Let's not traffic in hope. Instead, let's together fiercely and doggedly rise to the calling of a new professional ethos, one that puts justice at the fore. You're at Yale. Use this privileged place to educate yourself. There's no better advocate than an astute clinician. And when your patients confide in you, and when you bear witness to their suffering and see these uncomfortable truths, you'll then have the ability to collectively sound the alarm, confront our own complicity, identify with courage, with partnerships, science, and clinical care, how best to tackle our nation's persistent inequities in health. Only then are we going to actualize our fullest potential as a profession, and this, I think, is the deepest way that we can walk in our patients' shoes. Thank you very much. It's a real joy to be here.
That was a challenge. Now you have your work cut out for you for the next 4 years, or 5 years. So now is the time that we come to that I think you're all waiting for, but I know your parents are definitely waiting for it. And this is the time at which we present the white coats. So joining me on stage to help me give out the white coats, we have Dr. Richard Belitsky. You want to stand up? The Deputy Dean for Education, Dr. Darren Lattimore, Deputy Dean for Diversity and Inclusion, Dr. Emily Wang, who you just heard from, Associate Professor in the Department of Medicine, Dr. Nancy Angoff, Associate Dean for Student Affairs. Dr. Angoff graduated from Yale in 1990. Dr. Barbara Kazmierzak, Director of the MD PhD program, and Dr. Laura Ment, Associate Dean for Admissions and Financial Aid, and I'll introduce IASC in a second. You can sit down. Building on a tradition that started with the bicentennial celebrations in 2010, Lillian Oshva, MD, a member of the class in 1996 and president of the Association of Yale Alumni in Medicine, and Amy Liebeskind, MD 98, Vice President of AYAM, will join us on stage to present stethoscopes to each new student. The awarding of these stethoscopes is sponsored by our generous alumni who want to welcome you to their favorite medical school. And now I'll introduce, joining at the podium will be our Director of Admissions, Ayaska Fernando, who will call you to the stage to receive your white coats and stethoscopes. Together with Dr. Ment, Ayaska played a critical role in selecting you as the latest class of students, and I have no doubt that you will agree that he has excellent taste. Thank you. Ayaska, you want?
Yes. Thank you, Dean Alpern, and good afternoon, everyone. Class of 2023, here is the plan for receiving your white coats. Your names will be called alphabetically by last name. When I announce your name, come up stage left for your white coat. There will be handshakes and a photograph. Be sure to look at the camera and smile when shaking Dean Alpern's hand. This is where the camera will be. And you will be handed your stethoscope donated by the Association of Yale Alumni in Medicine before exiting stage right. Parents, friends, and family, if you're interested, the best place to take photographs is stage right, which is over here. So that will be the best angle, the best view, and that's where the official photographer will be as well. Okay, let's begin. Brendan Atkinson from Marietta College entering the MD PhD program. Jafar Al-Suz from from the University of California, Irvine, entering the MD PhD program. Sidhu Maybe Alim from Howard University. Mariana Almeida from Dartmouth College. Robert Emick from the University of California, Los Angeles. Emily Avery from Princeton University. Douglas Barber from Brown University. Jenna Bergman from Barnard College, entering the MD PhD program. Gabrielle Betancourt-Velez from Yale University. Joseph Brancoli from Harvard University, entering the MD PhD program. Yuming Cao from Brown University. Shinmei Chan from Stanford University. Erica Chang Sing from the University of Southern California. Fuyao Chen from Vanderbilt University, entering the MD PhD program. Gloria Chen from Harvard University. David Chung from Brown University. Samuel Kraft from Middlebury College. Lake Crawford from the University of Kansas. Elalan de Gife from Pomona College. Maya Deshmukh from the University of Michigan, entering the MD PhD program. Pranamya Dey from Yale University. Mira Dodapkar from the University of Chicago. Madeline DiGiovanni from Brown University. Mariana Do Carmo from Yale University, entering the MD PhD program. Jeffrey Duncan from Haverford College, entering the MD PhD program. Chalisa Fierce from Spelman College, entering the MD PhD program. Mursal Gardizi from Brown University. Aidan Gilson from Massachusetts Institute of Technology. Kevin Givachian from the University of Southern California, entering the MD PhD program. Joshua Glan from the University of Pennsylvania. Ilhan Gokhan from Duke University, entering the MD PhD program. Kerry Green from Massachusetts Institute of Technology, entering the MD PhD program. Daniel Grubman from Dartmouth College. Scott Grubman from Dartmouth College. Brett Gu from Yale University. Clara Guo from Dartmouth College. Scott Halperin from Tufts University. John Havlick from the University of Chicago. Michael Heian from Cornell University. Sajid Hossain from Villanova University. Joshua Hutler from the University of Virginia. Erica Wong from Washington University in St. Louis. Chinye Ijeli from University of Chicago. Guneet Janda from The Ohio State University. Ann Johnson from Georgia Institute of Technology, entering the MD PhD program. Samipya Kofle from the University of Nevada, Reno. Adiana Carla Quesada from Oregon State University. Nabil Qassam from Northwestern University. Jahanzeb Kayani from the University of Connecticut. Christopher Keyes from Brown University. Adam King from Lawrence University. We'll take a pause for the helicopter to go by.
That's healthcare.
Yeah. That's healthcare, right? Yes, yeah, that's right. Yeah. Okay. Emre Kuzultu from Duke University. Jonathan Kluger from the University of Pennsylvania. Srija Kodali from Yale University. Chigoziri Konkwo from University of Pennsylvania. Sophia Lapidis Wilson from Yale University. Dana Lee from Yale University. Christina Lepore from Wellesley College. Amanda Lieberman from Colgate University. Samuel Libbard from the University of the Virgin Islands, entering the MD-PhD program. Hieronymus Loho from Yale University. Ragini Luthra from Yale University. Mara Jawad Fayez Maya from Yale University. Michelle Matesva from University of Pennsylvania. Hunter McCurdy from the University of Wyoming. Ryan McLean from the University of Connecticut. Chandler McMillan from Duke University. Usman Monir from Columbia University. Jay Moran from Trinity College. Alyssa Morrison from Stanford University. Mazamel Mohammed from Stanford University. Michael Murphy from Johns Hopkins University. Aishwarya Nene from California Institute of Technology. Autumn Nobles from University of Georgia. Jamison Omar from Stanford University. Yolanta Poch from Yale University. Carmen Pajarillo from Boston University. Hanya Qureshi from Columbia University. Divya Ramakrishnan from Stanford University. Kelsey Rankin from Harvard University. Benjamin Reeves from Yale University. Jack Robbins from Florida State University, entering the MD-PhD program. Alicia Rose from Dalhousie University. Alexander Sassy from Vanderbilt University. Claudia C. from Yale University. Rima Shah from Duke University. Apurv Shaker from Johns Hopkins University. Josiah Sherman from Xavier University. Amrita Singh from Columbia University. Lauren Smith from the University of Oklahoma. Zihan Su from Williams College. Anush Swaminathan from Boston University, entering the MD-PhD program. Abriana Tassilo from Boston University. To Tran from Yale University. Siddharth Tyagi from the University of Colorado Boulder, entering the MD-PhD program. Tanvi Varma from Wellesley College. Juliana Veira from Williams College. Michael Vitek from Rutgers University, entering the MD-PhD program. Vicky Wong from Stanford University. Leslie Wong from Yale University. Gabe Weininger from Stanford University. Julia Wolf from New York University. Deanne Yugawa from the University of Utah, entering the MD-PhD program. And Tiana Zhou from Yale University.
I was going to tell everyone to leave. Okay. So this is my 16th white coat ceremony, and I have to say, every time I shake these hands, I'm convinced the admissions committee has admitted at least 200 students to the class. It sounds like a wonderful class from a lot of really terrific schools. So now we will have our Nancy Angoff, Associate Dean for Student Affairs, will present the Human Relations Code of Conduct.
So to give you some context, earlier today we spoke with the incoming class about the Yale system and the community that it creates and all of the responsibilities that we have to one another in that community. This code of conduct is an explanation of some of the principles that we live by. So I invite you to follow along as I read it. Yale School of Medicine is committed to the promotion of personal and professional development of all individuals in its community and encourages dialogue that will foster the growth, well-being, and dignity of all its members. In pursuit of these goals, the school is dedicated to maintaining an environment that places the highest priority on collegial relationships, mutual respect, and sensitivity among its students, faculty, staff, and patients. An educational community functions best when there is civility and respect for the dignity and worth of each individual. It must be ensured that our school is free from discrimination and acts of intolerance, such as those based on race, gender, sexual orientation, religion, national origin, ancestry, age, or physical handicap. This commitment remains consonant with the obligation to protect open and wide-ranging public discourse. The principle of freedom of expression that might otherwise protect even the most offensive public speech does not protect, nor does it even encompass, a right to threaten the dignity and privacy of an individual. Such personally directed behavior will not be tolerated. It is antithetical to academic values, debilitates its victims, compromises the offenders, and undermines the university's fundamental commitment to individual freedom and respect for all its members. Furthermore, acts of intolerance may destroy the very atmosphere wherein freedom of expression is otherwise tolerated and cherished.
And with that, I congratulate the class of 2023 and invite you all to a reception here on the Harkness lawn. Congratulations.